I'd like to tell you why concentrated bone marrow and stem cell procedures have become a part of my tools in helping people get better. So, as I was going through life as a family practice doctor, one of the main tools that I have is prescribing medications, and there's also some minor surgeries and things like that I do. However, I found it unsatisfying that I wasn't really helping people get a lot better, especially as many people as I had that were complaining about joint pains and problems. Because I had so many people with joint discomfort, and the last thing that they had to do, or the last resort that they had, was to do surgery. So I didn't really want to have to do that for those people. I wanted them to have another option. There were several things that I looked into. One was a measure or an injection called viscosupplementation, which you don't have to remember, but what it does is gives you some kind of Teflon coating inside the joint. But you know what? It didn't really work that well. Some people it works okay, some people not. But either way, it didn't last very long. So I wanted to find something that would last longer and give people relief with decreasing their pain and increasing their function of their joints, whether it be their knees, their hips, their ankles, their shoulders, their elbows. All of them came with problems at times. So I wanted to be able to do something that would help all of them. So I researched this, and I came upon concentrated bone marrow and stem cell injections. Now, why would I do that? What is it about stem cells and these particular ones derived from bone marrow that makes it better than something else? What happens is stem cells that are created in the bone marrow are uniquely suited to become tendons, bone, cartilage, and other soft tissues that would be quite helpful in healing a joint. And because it's so helpful in making them better, it is the best way we can get those joints rejuvenated without having to do a large surgery and replacing the joint. In the joint replacement surgeries, you can't go backwards. You can't reinstall the joint they took out just because it didn't work as well as you wanted. And that's the other thing I like about this, is that you can still go on and either do more stem cells or you can do a joint replacement in the future if you so desire. So it doesn't limit your potentials for other treatments. So I really like this option. So I wanted to get the best type of stem cell we could. So the bone marrow derived concentrated stem cells is much better than getting them through other means. For instance, fat cells, or out of umbilical cords, or from other people. If you can do your own cells will heal you better than anything else. So that's what I liked. And then now that I've done this for about 6 years, and I've had over 60 cases of people that have been improved by this, I am excited to offer it as a treatment plan for people with joints that really hurt, that don't want to get their joints replaced yet.